I'm Colin Bair, working together with Gage, Mowrey, and Justin Kwak, and we are doing a public service announcement on methicillin-resistant Staph aureus, aka MRSA.
MRSA, also known as methicillin-resistant Staphylococcus aureus, is an antibiotic-resistant strain of bacteria in the family Staphylococci. Staph aureus is a very common bacteria found to be living in approximately a third of all people, often in your gut and nose. Most strains of staph are harmless, living symbiotically with people most of the time. However, strains such as MRSA, VRSA, or VISA, which are methicillin-resistant or vancomycin-resistant staph infections, and they can cause a variety of health issues from anything as severe as endocarditis, which is inflammation of the heart, to common staph infections, which are small pieces of pus found in infected wounds. MRSA can also typically be divided into two different subsections: community associated MRSA and hospital associated MRSA, or hospital acquired. Community associated MRSA is also known for causing more virulent reactions in people, whereas hospital acquired MRSA is less virulent. However, community associated MRSA is more susceptible to different families of antibacterials, versus hospital acquired is more resistant to different classes of antibacterials. MRSA is also one of the most common pathogens found in hospital and community acquired infections, and it typically has been seen to be declining in the US, but that is only because there's limited studying of it done. Currently, only around 16 million people in the US are known to have been participating in a study for MRSA, spread across 5 different states, calculating for a total of 3,051 cases of MRSA infections per 100,000 people. And those most at risk are people who are most commonly in contact with people with MRSA, which can include healthcare workers or anybody that is in close contact with unhygienic surfaces, which can include students or military personnel in barracks or just athletes in contact sports.
Current public health efforts to combat MRSA include two efforts in tracking MRSA done by the NHSN and the EIP, both of which are trying to give a general view of how the United States is dealing with MRSA. Other efforts include MRSA research, where the CDC is researching the effects of chlorhexidine mupirocin on MRSA and has found that use in ICUs reduces MRSA infections by 37%, as well as Project Clear's research, which compared discharging patients with only hygiene education with patients that were discharged with hygiene education and serial decolonization, and found that those who were educated and decolonized had 30% less MRSA infections in the years following discharge. What can be done next? As evidenced by the study done by the CDC with Project Clear, we need more education surrounding hygiene for patients leaving medical facilities, as well as resources for them to serially decolonize themselves to combat MRSA infections. Hospitals also could implement heightened surveillance of patient care to track infections. In addition, as the Rush University Medical Center's research is doing, we need to do more research into potential interventions in order to reduce infections between medical facilities and public settings.
So where can the general public find information about MRSA? For the public, information regarding MRSA is readily available at CDC's website in the section specifically for MRSA. And in this section, one can find all different types of information, which include general descriptions regarding MRSA, possible ways to prevent infection, how laboratory testing works for MRSA, and the current CDC's efforts to reduce MRSA infections. If an individual does get an MRSA infection, one can get care fairly easily. As with other common infections, even though MRSA is resistant to certain antibacterial, MRSA can still be treated properly with a simple visit to a hospital. So, how would individuals recognize that they have an MRSA infection? With the most common type of SA infection being through skin, some common symptoms include a part of skin that is red or swollen, warmer than usual, or that is irritating. As such, when one has one of these symptoms, they can make the proper decision to go visit a hospital to receive care. A common misconception regarding MRSA is that it can only occur within the hospital setting, where antibacterial is most readily used. However, nowadays, CA-MRSA, which refers to the strain of MRSA with origins unrelated to healthcare setting, is also recognized as a popular type of MRSA. And in fact, according to a figure by the CDC, the number of cases per 100,000 is far greater for community onset cases than that of hospital onset cases, all throughout 2005 to 2016. Thus, such assumption is very incorrect.
Here are the references for our project. Thank you for your time.